Do you frequently feel like you keep catching colds, sinus infections, or lung issues, even after taking care of yourself? Maybe your body is fighting germs, but not in the right way. That could be a sign of something called Specific Antibody Deficiency, or SAD. It's not that your immune system is weak. It actually makes antibodies. Those are fighter proteins, but not the right kind when faced with certain bacteria. For example, imagine you get a pneumonia shot, but your body doesn't make enough protection from it. That's SAD in action. Many people don't know they have it until they've had repeated infections over years. Think of it like having a security team that shows up to work, but doesn't recognize the thieves. So why does SAD happen? Well, the exact cause isn't always clear, but doctors believe it's often due to a small glitch in how your immune system learns to respond after vaccines or infections. Let's say you get the pneumococcal vaccine, one that protects against pneumonia. A healthy body makes strong IgG antibodies. But in SAD, your body either makes weak ones or skips making them altogether, especially to certain sugar coats, called polysaccharides, on bacteria. It's like having a fingerprint scanner that works for some people, but not others. Now, is it genetic? Possibly. Some families have multiple members with weak responses. But it's not like catching a virus. You're born with this trait, but it only shows when infections keep coming back. If you're someone who gets sinus infections 4 to 6 times a year, or bronchitis that just won't quit, that's a red flag. Maybe each winter you end up on antibiotics more than your friends. Or perhaps ear infections keep coming back, even as an adult. Coughing for weeks after a cold, that's not normal. One patient said, "I thought I was just weak, but after 10 sinus infections in 2 years, my doctor checked my blood." Others notice they get very tired after infections, or they miss work often. It's not just being sickly, your body might be making antibodies, just the wrong kind for certain bugs. How do doctors find out? They start by asking about your infection history. How many, how bad, how treated. Then comes a blood test. They check your basic antibody levels, IgG, IgA, IgM, which are often normal in SAD, so it's tricky. The key test, they see if your body made antibodies after certain vaccines, especially the pneumococcal shot. If you got the vaccine but your blood shows low protection, that's a clue. Some doctors give a vaccine on purpose and retest in 4 to 6 weeks. Now treatment, not everyone needs medicine. If infections are mild, you might just take care early. But if not, options include daily antibiotics to prevent flare-ups, or even immunoglobulin therapy, IgG shots, or infusions, like giving your body the antibodies it should have made. It's like hiring backup security when your own team misses a few criminals. Can you stop SAD before it starts? Well, since it's likely something you're born with, you can't prevent the condition itself. But you can prevent the damage it causes. Think of it like wearing a seatbelt. You can't stop accidents, but you can reduce harm. So getting all recommended vaccines, especially pneumonia and flu shots, is key. Also, washing hands, avoiding sick people, and not smoking protect your lungs. If you know you get sick often, talk to your doctor early. Tracking infections in a journal, like NOV5, bad sinus infection, antibiotics, helps prove a pattern. Catching SAD early means fewer long-term lung problems, like bronchiectasis, damaged airways. Prevention here means smart habits and smart monitoring. The good news, scientists are digging deeper into SAD. Recent studies show some people with SAD have slight gene differences in how immune cells learn from vaccines. Others are testing better vaccines that don't just use sugar coats, like combining them with proteins to help more people respond, called conjugate vaccines. There's also growing talk about naming SAD more clearly. It's often missed because test results look almost normal. Now, some doctors push for new rules. If someone has many infections and poor vaccine response, even with normal IgG, they should be treated. Trials are even looking at low-dose Ig therapy only during winter months, like a seasonal shield. The goal, no more guessing. Spot it earlier, treat wisely, live better.